Good afternoon. Welcome you all to the High Performance Architecture webinar series. I'm Lan Ding, Associate Professor at UNSW School of Built Environment and the convener of the High Performance Architecture Research Cluster. Before we begin, I would like to show my respects and acknowledge the Bidjigal people who are the traditional custodians of the land on which this meeting takes place, and to the elders, past and present. This is the fourth High Performance Architecture webinar series this year. The speaker is Associate Professor Paul Osmond from UNSW School of Built Environment. Paul has qualifications in applied science, environmental management, and landscape design. He is the university's representative to the Green Building Council of Australia, member of the editorial board of Urban Morphology, Urban Planning, and Architecture. In today's webinar, Professor Paul will present Randwick Health and Innovation Precinct Living Infrastructure Strategy. If you have any questions during Paul's talk, could you please put in the chat, and Professor Paul will answer as many as possible at the end of his talk. Also, just a note, this talk will be recorded. We would appreciate you switch off your microphone and your video if you do not wish to be seen in the recording. Paul, over to you.
Thank you, Professor Lan. I've got a few acknowledgements to make before we start. And the first acknowledgements are to our two research assistants, Dr. Louise McKenzie and Christopher Robinson. Christopher is a PhD candidate with us in the School of Built Environment. And they're responsible for preparing a lot of these slides, which were prepared as part of the development of the strategy and presentation of material to people from the Randwick Health and Information Precinct, which I'll tell you more about as we go through. So my slides may be a little bit slow because as I mentioned to, as I mentioned to Lan, I'm having a slow computer day for some reason. So project leads, Associate Professor Kate Bishop, and myself and Emeritus Professor Linda Corkery. And both Kate and Linda are from our Landscape Architecture program. And as I mentioned, Louise and Christopher. So acknowledge the team and move on very briefly. Lan has already given an acknowledgement of country. What I would add to that, I'm also on Bidjigal land here in Randwick. What I would add to paying my respects to elders past, present, and emerging is if you're interested, if you know what Indigenous land you're on, because people are joining this webinar from all over the place, please just drop us the name in the chat function. So let us know whose land you are chatting from. So today's talk, just very briefly to summarise, what is the Randwick Health and Innovation Precinct? What is living or green infrastructure? The important link between living infrastructure and health and well-being, which is the big motivator for this project. And then looking at a bit more detail at some of the principles and priorities and precedents and so on around this strategy. So what I've done here with some of these images, you'll note they're from all over the place. This particular one is from Boston Medical Center rooftop, which is a well-known worldwide and early pioneer of urban agriculture on a hospital roof. So we're looking at some of these as precedents for potentially some of the things that we could do with the Randwick Health and Innovation Precinct project. But first, what are we talking about? As you can see from the image there, on the left-hand side, we've got the University of New South Wales upper campus buildings. On the right-hand side, we've got existing hospital buildings, the hospital complex in Randwick. And in the middle there, you can see work progressing with some new buildings. And it's actually advanced a lot more since that aerial image was taken. So it's a very big project. University overall is committed to a number of different precincts around the place, which are focusing on health innovation, teaching and research. And the intent of precincts is to bring together stakeholders from a range of areas, from government, from the private sector, from the education sector, to collaborate around initiatives that are going to have significant societal and social and research impact. With the Randwick precinct, we are talking very serious money. It's attracted about $1.5 billion investment, much of that from state government, and also a bit more than $500 million, I should say, 550 million from UNSW across a 10-year span. So there'll be a lot of work going on over a fairly lengthy period to establish this world-class centre. So some quotes from the vision, the purpose, the strategy, not our strategy, but the Randwick Health and Innovation Precinct strategy. The vision is to be transformative, collaborative, and a place of excellence. So addressing global challenges around health, around lifelong health and well-being. Purpose is to leverage partnerships and connections with stakeholders in order to achieve these positive outcomes. What we're talking about is 3 major teaching hospitals, 9 medical research institutes covering a range of different health areas. At the moment, there's about 1.8 million patient transactions with these healthcare institutes and hospitals and so on every year. Workforce predicted of 22,000 for the precinct overall. And in terms of research, about 7,000 researchers. The University of New South Wales, as those connected with UNSW will know, has got a very strong reputation around research excellence, but particularly impact. So research which has impact in the real world. And we have about 58,000 students. So you can see we're talking about a small city. I'll leave you just to read the last bits there. I won't read it all out for you. So it's bringing together all these different agencies in the event of innovation being the key driver of all of this. And this is, you'll see a bit later on, we use a similar diagram in reference to our strategy. This is the RHIP's strategy diagram showing what the main aims are: the global and local impact, clinical and academic excellence, innovation, collaboration as the key drivers in the middle of the strategy, supporting themes, and then leading to the impacts and benefits with a range of enablers around governance, people and culture, and so on. And one thing I will say here is that, as you can imagine, with such a big project, with so many different stakeholders, the governance is actually quite complex. And we've been working very closely and collaboratively with different groups within that governance structure in order to, I suppose, sell our strategy in the first instance, but gain support from the different stakeholders and make the development and then ideally the implementation of the strategy a very smooth process going forward. So that's what the precinct's about. What's green or living infrastructure about? It covers both the natural environment and also those kinds of design and engineering and planning interventions which can mimic the natural environment. So basically, if we were to sum it up, going from the big to the small, it's everything from parks, street greenery, street trees and so on, water sensitive urban design, things like rain gardens and swales and so on in cities, courtyards, roof gardens, living walls, and so on. It includes things going right down to what have been called pet pots. So we've got one here which is representing Frankie. Now, those of you who were around UNSW a couple of years ago when the lockdown was happening might remember there was at least one anyway, fox hanging around the campus at the time. And he got dubbed Frankie the Fox. So there he is there masquerading as a pet pot. The key thing about living infrastructure, what we're doing is providing something here which is the source of those services which notionally, and I underline the word notionally, nature or the biotic environment provides to humanity free of charge. Of course, it's not free of charge. The estimate from some of those who've done work on this from a global perspective suggests that these services are worth at least 125 trillion annually, and that's in US dollars. So we're talking about very, very serious money, which is in excess of the world's GDP by a long shot. Looking at the benefits, a single tree can do all these sorts of things. It can provide shade, it can improve our mental health, it can reduce air pollution, both particulate and absorbing some of the gaseous air pollution, increases property values if you live around a green area, green neighbourhood, provides habitat, provides biodiversity, and the list just goes on and on and on. So these are the sorts of benefits coming out of living infrastructure, and a lot of them you'll note relate to health in the sense of not just absence of disease, but the positive benefits of health and well-being. So it's been argued, and I think correctly, that it's not just something which is nice, it's not just icing on the cake, but it's a must-have for human physical health, cognitive functioning, mental health, and arguably social health, spiritual health, any dimension of health you want to look at. And I love this term, nature deficit disorder, which is actually Richard Louv, what he was saying was that if we don't get enough exposure to greenery, it's actually deficit. It's a little bit like if we don't get enough vitamins or if we don't eat properly, we have a deficit of nourishment. Well, we have a deficit of nourishment from nature if we don't get out and about in it often enough. So that's a bit of a plug for green infrastructure in general. In terms of the health sector, health infrastructure projects, there's an increasing recognition in and across the health sector of the importance of sustainability. So triple bottom line, social, environmental, economic. And that links as well to what I was saying before, not just the absence of disease, but the holistic well-being for patients, but also for visitors who can be very stressed out. Staff who we know are overworked and stressed out, particularly at the moment with an ongoing COVID pandemic. And then looking at the broader community context as well. So this is the kind of principles that we're coming from, that we're taking our strategy from the start at the kind of higher level. Living infrastructure delivers a well-evidenced variety of health benefits, and the literature goes back decades on this, right back to one of the early studies where by a guy called Roger Ulrich, whereby two cohorts of patients who'd gone through gallbladder surgery, similar times, same hospital. One of the groups was in a ward which had a view of brick walls out the window. The other had a view of trees, parks, gardens, nature out the window. And the evidence from, albeit a fairly small group, was that those who had that exposure to nature, they got better quicker, they required less pain medication, and so on and so forth. So that was one of the really early studies. That was in the 1980s. There's been so much before and after where it is just so obvious that living infrastructure is critical to optimal health outcomes in a whole range of areas. So this is where we're coming from with the strategy, acknowledging the health sector is very much in tune with sustainability these days and with living infrastructure, and acknowledging that the living infrastructure can help provide some of these sustainability outcomes that the health sector is looking for. One of our arguments with this strategy is that while we know what the benefits are like for being immersed in nature, for looking at it, for walking through it, even looking through a window at greenery, an interactive approach to living infrastructure in which people are directly and physically engaging, for example, things like community gardens, urban agriculture, things like therapeutic gardens, which people can get their hands dirty if it's possible, if they're allowed to from a health perspective as patients, and also for staff, as I was saying before, for visitors and for the wider community. So our argument is that interactivity, that capacity to get involved, is going to expand the benefits. We already know the benefits, but to expand the benefits that we're aware of just from looking at nature, if you like, by being interactive with it, can really make a big difference. So we came up with 3 priorities with the strategy about, well, the first priority or overarching one is to add value. And I'll talk a bit more about that in a minute. But the 3 priorities around health promotion, environmental enhancement, and social connection. And I'll give some examples of that as we go through the next few slides. So this is our take on the target diagram that the Health and Innovation Precinct has adopted. So we're starting with those 3 points of health promotion, social connection, environmental enhancement. And you'll see those little colours, the orange, blue and green, in the top left-hand corner of the slides. That's what it's actually representing. So the precinct and the community, the social connections, casual, planned engagement, education, the environmental enhancement leading to comfort, safety, sustainability, research projects, health promotion, both physical and mental, and looking at aspects such as experience, the restorative aspects of greenery, nourishment, so looking at food potentially as an example of interactive green infrastructure, and encouraging movement. So looking at ways of getting people actually moving through an environment and the physical health aspects. Okay, so what do we mean by adding value? The overall value proposition is not just about having a strategy document saying lovely things. It's about using the strategy to underpin a program of projects that are beneficial right across the health and innovation precinct, and importantly, that can be developed up to target external funding opportunities. So we're not saying we want funding from the university or the hospitals necessarily. We're saying, look, these sorts of projects that we're developing stand on their own 2 feet. We can look at partnerships with industry, with government, with a whole range of external organisations to attract funding. The strategy, the intent of it is to embed these sorts of innovations in a way which complements the overall development of the precinct over that 10-year or so period of time, and also to have a provision for evaluating these innovations and projects. So a kind of post-occupancy evaluation or other types of evaluation, what works, what doesn't work, and why, and what lessons can be drawn from that to potentially pilot innovative living infrastructure across a healthcare precinct in other areas. So, for example, the Westmead healthcare precinct in Western Sydney is a good a case study for that. The projects themselves, we are aspiring for things which are unique and innovative, and certainly drawing on and enhancing and putting forward best practice to link in with what the precinct stakeholders have made very clear they want to see, which is a reputation for innovation and leadership in their approach to holistic and sustainable healthcare design. So again, to reinforce what I've just been saying, the 3 major areas of health promotion, social connections, environmental enhancement, as the framework to help us identify strategic projects and develop that matrix of projects, which is currently where we're at with the strategy. We've developed the core principles, and now we're looking at potential projects in a very general sense at the moment, but we'll come to that a little bit later on with the slides. So the idea being that each project will be described against the opportunities represented by the people involved. For example, the teaching and research connections with the university, and maximising the capacity we have as a multidisciplinary institution. I'm talking about UNSW, but also bringing in other stakeholders from the precinct with that broad cross-section of knowledge and expertise around built environment, around urban greening, around health and well-being. So again, the intent is to think about the projects as representing part of living laboratories and crucibles of best practice. So just as we've said before, looking at global ecosystem services and what they're worth to the planet and the threat that they're under from things like global warming, depletion of biodiversity, and so on, just as these services depend on ecosystems globally being healthy, so in our microcosm that is the Randwick precinct, the benefits to human well-being depend on the health of the living infrastructure within that precinct. So part of what we'll be doing in our strategy and in delivering various projects is looking at measuring, monitoring living infrastructure performance, both in and of itself, how the plants, how the living material is actually performing, is it surviving, is it doing well, is it thriving, and also in relation to its interactions with human beings. So to give an example, if we're talking about reduction of urban overheating effects, how well does the relevant living infrastructure that we've introduced or we will be introducing, supporting for providing those cooling capacities, how well are they working? Are we getting the cooling that we are aspiring to? And of course, this is not just talking about physical interventions. That I'll come to that in a minute, but it's also looking at existing as planned, as designed, the landscape design of the precinct, the structure of the buildings, the performance of the buildings. We can provide that research capacity to evaluate and examine what the performance is like in and around the context of ecosystem services. There will be distinct living infrastructure interventions, with the idea being that they could potentially be deployed in similar health precinct contexts. We're calling these enhancement projects. At the moment, we're putting up some general ideas around those for consideration by the stakeholders in the precinct. So it's really very much up to a consensus, what people think would be valuable, again, in terms of that living laboratory, the best practice crucible, and the value add. Both sorts of projects can include things like projects relating to patient well-being, staff well-being, indoor environmental quality, therapy, rehabilitation, so really linking well into the healthcare side itself, biodiversity conservation, microclimate, pardon me, microclimate mitigation, so urban overheating aspects, urban agriculture, food, and of course a lot more. So the remainder of the slides, and we'll be finishing relatively early because I want to allow lots of questions. I've got a couple that have come in pre-questions that I'll be answering first. So remaining slides looking at some precedents, and we'll be using those precedents to put forward to the other stakeholders with the precinct and precinct governance folk the kind of things that we think would be valuable for the Randwick Health and Innovation Precinct itself. So some examples. This is a research project example, UK, a couple of years ago, and it's called Space to Breathe. And the intent there was to look at staff wellbeing, so health staff wellbeing from the NHS, National Health Service in the UK. So looking at sites, maybe repurposing sites or opening up sites or developing new sites where staff can rest, relax, unwind, restore, and also combining that with surveys, site walks, workshops, again, as an evaluation exercise to see what works, where it works, when it works, why it works, drawing the insights and lessons from that. Bendigo Hospital, that's actually that's incorrect. It should be Victoria, not New South Wales, but never mind. So again, looking at performance of a relatively new landscape in the Bendigo Hospital grounds, and looking at, as a research project, how it's being used and what insights can be gained from that. We all know that landscapes, designed landscapes, are not always used as the designers intended or as the brief specified. People will find their own ways to utilise green space or outdoor space in general. So part of the exercise with this project, and something which would be really good to apply in Randwick, would be a behaviour mapping and observation study to see just how people, whether it's staff, whether it's patients, or the local community, or all of the above, are using the outdoor spaces around the healthcare buildings and getting the insights from that. So looking at an education related project and looking at walkable environments for heat, comfort and microclimate. So again, how do we make those outdoor spaces more usable? We all know that people benefit from moving around. People benefit from walking. It's good for you. But the hotter it gets, unless we design specifically to create more comfortable microclimates, the hotter it gets, the less people are going to be walking around and the more they're going to be driving their cars. So we need to look at healthy built environment checklists around planning for parks, for gardens, for walkable and bikeable spaces. And part of that with the Randwick precinct is to consider not just the immediate surrounds of the healthcare buildings, but what are the connections between the local Randwick area, including its own bike paths, its walking paths, its parks, and the healthcare precinct. Because the intent there is not to have something which has got high walls around it, and this is just RHIP. What we're talking about is something which is transparent, which is permeable, which will allow the community access to it, other than obviously private spaces, but there'll be public and semi-public spaces for access by the local community, and encouraging people to walk, encouraging people to utilise those spaces. So how do we make them more comfortable? How well are they being used in terms of walkability? Now, this one is from the United States. So we've got, and I'm just checking my cheat sheets here. So thank you, Linda Corkery, Emeritus Professor of Landscape Architecture, who provided some information about these sites. So Akron, Ohio, Children's Hospital, and also Benioff Children's Hospital, which is in, I don't think it's on the list, but it's in the USA. And the idea of this is to get the children, because children's hospitals, actually involved in what you might call food as medicine. So food pharmacies. They're actually getting their hands dirty where they can, and learning about what sort of food they can grow for good nutrition. And particularly you think of urban kids who might think that what they eat comes from supermarkets. Well, there is the original place it comes from, which is the ground. And this provides an opportunity for kids to get involved and get their hands dirty in these sorts of projects while learning about something which can last them their entire lives, eating well. So this is slightly different. It's an interactive project example. So looking at a hospital in Perth, Fiona Stanley Hospital in Perth, art and garden walk. So linking landscape design and art in a way which is also encouraging people to use the space, providing resting spots with shade, providing beautiful natural features for them to wander through, and artworks as well as that. So linking all of these things together to provide a memorable experience as an interactive exercise for people using those sorts of spaces. Another interactive project, and I'm sure a lot of you will have seen these sorts of pop-up landscapes around the place, which fantastic idea, and particularly where you can see in the bottom left-hand side where they're actually pop-up landscapes replacing, albeit temporarily, car parks. What a much better use of a space as a nice little picnic table and some greenery, rather than just sitting a dead car on it. You don't even need to ask the question, it's so obvious. Composting seats. This is something that Michael Mobbs in Chippendale is one of the pioneers looking at outdoor seating that also masquerades as composting. So outside your restaurant, your cafe, put your food scraps in there, and then people can come out, as you see the top right-hand corner, enjoy a cup of coffee sitting on a compost bin. And because it's been properly composted, it doesn't smell. Looking at some more therapeutic and rehabilitation type projects. Well, we've got the existing fairy garden, so Fairy Sparkle at the Children's Hospital in Randwick. Some of you are probably familiar with Fairy Sparkle. That's a garden. And then horticultural therapy, using gardening to improve people's physical, mental, emotional well-being. So it's totally integrated with the kinds of services that healthcare precincts provide to patients, rehabilitation services. Food project example, we've already looked earlier slide at the Boston Medical Centre with the rooftop farm, and the food going directly to kitchens for patients, staff and visitors, and staff and where possible patients also involved in the actual growing on the rooftop and getting their hands dirty. Also educational tours, looking at volunteers, running nutrition programs, a little bit like the pharmacy, food pharmacy ones we saw in the previous slides. And also pollinators, so looking after our bees. Another example, and Lynchburg in Virginia, and this is a hydroponic micro farm located in the hospital cafeteria. So there's a lot of interest and engagement with it by people using the cafeteria, and it's looking at, in 1.4 square meters of space, as much produce as 180 square meters outdoors can provide. So very, very intensive agriculture. Stony Brook University in New York is associated with the School of Medicine. And again, very intensive, so 209 square meters, producing about 680 kilograms of produce annually. And what they do is operate from what they call a farm to bedside concept. So supplementing patients' meals with fresh produce from the farms. Originally, it was funded through a Healthy Heart program from New York State Health Department, and managed through the School of Medicine there. So update, we're coming to the end. Timeline for the strategy, we're proposing a full draft by the end of this month with 6 developed project proposals. Not developed in the sense of ready to roll out, but developed in the sense of being able to get approval and sign off from the Health Precinct, Health and Innovation Precinct stakeholders. There's a review, an internal and external review in September and October, final document in late November, and then we're proposing that 2023 onwards, we'll be looking at an implementation schedule. Okay, so that was the last slide. It is 41 minutes exactly, so I'm 1 minute longer than I expected. Thank you for listening, and over to you for questions in the chat. And while people are putting their questions in there, I shall endeavour to answer the two that were sent in earlier on. And apologies, my computer is behaving somewhat slowly at the moment, so it might take a little while. Okay, Andrea, I would like to know more about strategies to improve urban biodiversity. Wow, that's a big one. Interestingly enough, I'm currently working on another project, which is dealing with a big developer in Western Sydney, where several of us are putting together some guidelines, design guidelines around urban cooling, urban overheating. And part of what I'm doing with that, they're keen to see a list of species which might be useful for that particular development in that particular part of Sydney. So I'm chasing up a lot of information about species, tree species, for example, which can provide lots of shade, which can potentially provide evapotranspirative cooling, which can act as channelers or blockers of wind. But also what I'm looking at is biodiversity as one of the key attributes. So what I like to see with these sort of things is combining a range of different objectives. Improving urban biodiversity is a huge, it would take a whole range of seminars like this to even touch on it. So I won't attempt to go into a lot of detail, but certainly it has become more recognised that it's an important thing to do as we become clearer on the importance of greenery and nature and green infrastructure, living infrastructure to human beings. And part of that, part of the whole thing about biodiversity is it provides greater resilience. If you've got a lot of different species out there interacting and combining in ecosystems, you've got a more resilient environment than you do if you've simply got a row of pine trees. Not that a row of pine trees is evil. It's just not giving you, or a row of any sort of trees on their own, is not giving you the benefits of the diversity, the biodiversity. Strategies to improve it. One of the key things I would suggest is to ensure that stakeholders are involved in this. So local residents, suppliers of goods and services, local businesses, government agencies. It's something which requires a lot of dedicated involvement by a lot of people. I don't know really what more to say about it. It's a huge area. It's a challenging area. We know we're losing a lot of species. Overall, Australia's got a very poor track record in terms of extinctions. So it's really, I think, just a matter of getting more of the same happening, getting more projects out there, model projects, drawing lessons from them, promoting those projects, and getting as many people as possible involved in that improving of urban biodiversity. I hope that answers the question. Probably doesn't, because it's a massive area. So the second pre-question is from Kirsty, I hope I'm pronouncing the name properly, Kjersti. How did you decide which green infrastructure to use and other heat mitigating materials? Did you use maps or tools to prioritise your choices? That's a really good question. What we have been doing with a lot of our, well, all of our projects from High Performance Architecture Group in the Built Environment School has been to draw on evidence and to do the research to allow us to make these decisions about what works best. And I defer here to Professor Matt Santamouris, who wrote the book, literally, or several books, on exactly these points about materials for mitigating urban heat, about strategies combining green infrastructure, use of water, use of cool materials, and so on and so forth. So it's really, to answer your question, Kirsty, it's about getting the evidence and using that evidence to inform the planning, design, and management of our built environment. So thank you for the two pre-questions, and I'll see if I can find Lan. I might have to get you to read out the questions because I can't access.
Sure. So
the chat's not working for me. Sorry.
no problem. If you have any questions, could you put in the chat? So I will read and then Professor Paul will answer.
I can see I can't open the chat, but I can see there's 11 questions or 11 chats in there.
Yeah.
I just can't open it.
Okay. So are there any other questions? So there are no questions in the chat. So yeah. We can wait for a few seconds.
I've managed to open it now. It's a little bit slow, that's all. And thank you for all those people who have indicated which lands they're on. So we've got Gadigal, Darawal, Gadigal, Kumbangia, Kaurna, Gadigal, Noongar. We've got people from Western Australia. Nice.
Yeah, that's great. Okay.
Yeah, thanks for that.
If there are no other questions, we can see one more question. Are you doing work with some other hospitals or open to present to other hospitals?
At the moment, well, again, really good question, because some of our team have done other work with other hospitals. I don't know that anyone is from our team right now doing work with other hospitals, but we are certainly open to that, to present. And as I say, part of the takeaway from the Randwick Health and Innovation project is to have learnings from that project and from the strategy and individual projects coming out of it that can be transferable to similar contexts in relation to other health and education and innovation precincts.
Thanks. Another one, precinct planning in reference to pandemics for future.
Absolutely, and this is something we have spoken about and might well pitch some projects around this, where if you look at the three key things that people who know a lot more about pandemics than I ever would, so our epidemiologists and virologists and so on are saying vaccinate, masks, ventilate. Okay, ventilation intersects with where we come from as a built environment school. And that is a critical area we need to be thinking about in terms of indoor environmental quality and air quality in particular. And I see there's another question. Do any of the proposals influence indoor air quality, i.e. plant filtering of air? The answer is yes. We are going to be looking at breathing wall technologies, and we know of and have indeed in the past worked with some of the purveyors of those technologies. I won't mention names at the moment, but we have spoken about them, about potential projects to look at these kind of indoor air quality improvement type projects. Okay, there's approval for partial green roof on it's a different project, John. The green roof on the square house, it's actually I'm not sure if you're talking about the proposal for the green roof or the green terrace, which has come out of a project with both Waverley and Randwick councils, or the actual roof. But it's not really, because it's right down the other end of campus, it's not really considered part of the living infrastructure project for the Randwick Health and Innovation Precinct. It's not really considered part of that precinct, but certainly the precedent of working with people on potential projects within the precinct should give some joy, if you like, to people wanting to do some things on the walls and roofs of the uni buildings. Just going back to pandemics, in addition to the ventilate, vaccinate and mask, one of the things that has come out of reintroducing people back to workplaces, working from home back to offices and so on, is the need to have physical distancing and spacing of people. One of the techniques which has been used for that, but only sparingly, and it really requires more work and consideration, is using plant material, indoor plant material, and indoor landscaping, as well as the breathing wall technologies, to help demarcate indoor spaces to provide that physical distancing where we're trying to deal with these sort of pandemic issues of not getting everybody breathing their own air. And another thing which is actually painfully obvious that we should be doing is providing carbon dioxide monitors for people in those indoor workplaces, because carbon dioxide concentration, as long as we keep breathing out, and hopefully we do keep breathing out, otherwise there's problems, like we might be dead. As long as we keep breathing out, we will be putting in carbon dioxide into the atmosphere. Leaving aside global warming, what that does, if we are in a stuffy, unventilated space, we'll go to sleep. It'll make us sleepy. But more to the point, in terms of the pandemic, it is also a proxy for viral load. If you think of a lot of people in one room all breathing out, CO2 level is rising. The other thing that's rising, if there are cases, undiagnosed cases of COVID, is the viral load within that indoor environment. So if we give people monitors for spaces in the university, in hospitals, in other office situations, then we can actually monitor the proxy for viral load. And if it's getting high, we throw open a window. We take people outdoors for a walk. It's not rocket science. So that's just some other thoughts on pandemics.
Okay, great. Thanks, Paul, very much for your great talk and answering all questions. And also thanks to all very much
Two
for...
unanswered ones. Can I answer them quickly? I'm just looking at this.
Sure.
Yeah, sorry about that. Have you been referencing Green Building Council or other similar associations? Look, we've been drawing on some of the standards and rating tools, not in the sense of going for a Green Star rating or a well building rating or so on, because that's not our job. That's not what the Green Infrastructure Strategy is about. But we're certainly looking at some of the best practice coming out of those strategies to include in proposals that we're putting forward as part of the strategy. And I'd refer people to the Fitwell healthy building rating system, which I am a equivalent of they call it ambassadors, equivalent of the GSAP, the Green Star accredited professional for the Fitwell buildings. And there's a lot of stuff there we can draw, and also the well building rating system, which is the other system that's out there addressing healthy buildings. Alexa, who will own and maintain the living infrastructure? How to make sure it lasts well into the future? Great question. Some of the living infrastructure is already going to be part of what is being designed as part of the landscape design. Our role with that will be encouraging monitoring and measuring of performance and looking at interaction between people and the greenery and so on. So that will be something which is already built into the maintenance of landscapes. In terms of other enhancements, that's something that would need to be sorted, looking at the range of different stakeholders in the precinct. So there's individual hospitals, there's health institutes, there's a university, there's the list just goes on. So that would be strategies for maintaining and looking after would be part of what we would be doing in building into the strategy, our strategy itself, and also encouragement of hands-on involvement of particularly staff, where they're getting something out of it, staff involvement and staff buy-in into looking after some of these initiatives is a good way to go. Last question has just come in, and we do need to finish after this one. Hi, Paul. Will any part of the strategy look at revising planning codes or local DCP? Not in themselves, but certainly, Alex, if people out there from the council like some of the things that are being put forward, there's nothing to stop them from taking them on board. But we're not specifically, it's not something we've thought about. So interesting point though, so thanks. Okay, Lam, that looks like about it for the questions.
Okay, so thanks, Paul, very much for your great talk. And also thanks to all very much for joining us today. The next High Performance Architecture webinar will be in September, presented by Scientia Professor Santamouris. His topic is mitigating urban heat in Riyadh, Saudi Arabia, a detailed mitigation study. Thank you so much. Look forward to seeing you in the next webinar. Bye.
Thank you.